Hi everyone, my name is Rachel Niebuhr, and the following presentation is brought to you by myself and my partner Stacy Pence for Nutrition Through the Life Cycle Fall 2016 trimester here at MUIH. We hope you enjoy it. Throughout history, there has been much debate about whether or not babies should be fed exclusively on breast milk or formula. New mothers must make this personal decision every day, and there are many factors that play a role in the choice that they make. These factors include things like level of comfort, support system, medical considerations, and their lifestyle. Formula companies have been trying to keep up throughout the years. They do this by making claims such as their formulas include everything that a mother's breast milk contains plus more to improve the baby's vision and cognitive function. Although these claims can sound convincing, nothing can replace a mother's breast milk, and this is supported by authorities such as the American Academy of Pediatrics and the American College of Obstetricians and Gynecologists. The goal of our presentation is to show you why breastfeeding is one of the absolute best things a mother can do for herself and for her baby, and why, if she has the choice, she should choose to breastfeed. For women who are unable to breastfeed, we would like to inform you of the safest alternatives supported by the most current research in this area of study. Humans have been breastfeeding as long as they've been on Earth. In Egyptian times, since lactation failure was an issue for some women, they resorted to formula feeding and wet nursing. Wet nursing is when a nurse would breastfeed a woman's child. This was disapproved by many. Some people believe that the infant would come to love the wet nurse because she had nurtured the child and cared for them more than their own mother had. It was also thought that the breast milk could possess magical qualities that might transmit both physical and psychological characteristics of the wet nurse to the child. This was still a popular practice, and it was well paid and highly organized during this time. It became a prime occupation choice for many poor women. Formula feeding and feeding vessels were introduced around 2000 BC. These feeding vessels were made from many different kinds of materials, including wood, ceramics, and cow horns. A buildup of bacteria in these feeding devices became a huge problem since they were difficult to clean. This led to the death of 1/3 of all artificially fed infants during the first year of life. With this came the evolution of the modern bottle in the mid-19th century. This also brought about aggressive marketing. One popular claim was that breastfeeding would ruin a woman's figure. Although many claims were made trying to convince women that it was better for their babies and for their bodies to formula feed their baby, breastfeeding still remained medically preferred throughout the history of all methods. Breastfeeding rates continue to rise in the U.S. Among infants born in 2013, 81% started to breastfeed, 51% were breastfeeding at 6 months, and 30% were breastfeeding at 12 months. This high initiation rate shows that most mothers want to breastfeed and are trying to do so. The low rates among infants who are 6 and 12 months of age show that mothers do not continue as recommended. The rates suggest that the mothers might not be getting the support that they need, maybe from healthcare providers, family members, or employers. It contains all the nutrients that an infant needs in the first 6 months of life, including fat, carbohydrates, proteins, vitamins, minerals, and water. The breast milk contains about 3.5 grams of fat per 100 milliliters of milk, which provides about 1/2 of the energy content of the milk. The fat is secreted in small droplets, and the amount increases as the feed progresses. As a result, the hind milk, secreted toward the end of a feed, is rich in fat and looks creamy white, while the fore milk at the beginning of a feed contains less fat and looks somewhat bluish gray. Breast milk fat contains long-chain polyunsaturated fatty acids, which are DHA and arachidonic acid. These fatty acids are really important for the neurological development of a child. The main carbohydrate in breast milk is lactose. There's about 7 grams of lactose per 100 milliliters of breast milk, which is more than in most other milks, and it's a very important source of energy. The other kind of carbohydrate present is an oligosaccharide, which provides important protection against infection. Breast milk proteins differ in both quantity and quality from other animal milks. The concentration of protein in breast milk is a lot lower than in animal milk. The much higher protein in animal milks can overload the infant's immature kidneys with waste nitrogen products. Estrogen, progesterone, prolactin, and oxytocin are 4 hormones that help the breast make milk. The body knows how to adjust these levels according to what the baby needs, and this is something that formula cannot do. Estrogen and progesterone are the hormones that prepare the breast to make milk. They are released by the placenta during pregnancy and have 2 major roles. Their roles are to increase the size and number of milk ducts in the breast and to keep the body from making large amounts of breast milk until after the baby is born. Once the baby is born and the placenta is delivered, the hormones decrease. This decrease signals the body that it is time to make milk. Prolactin helps the breast make milk. After the birth of the baby, the level of this hormone increases. Every time the mother breastfeeds or pumps, the body releases prolactin. With each release, the body makes and stores more milk in the breast. If the level of this hormone gets too low, the milk supply will decrease. That is why it's so important to breastfeed or pump right after delivery and then at regular time frames. Oxytocin releases milk from the breast. When the baby begins to suck and draw the nipple into their mouth, this hormone is released. The release causes milk to be squeezed out into the ducts, out of the nipple, and into the baby's mouth. This process is called letdown or milk ejection reflex.
So the ideal diet while breastfeeding is consistent with a well-balanced diet for the mother. Breast milk can meet the baby's nutritional needs even when the mother's not eating perfectly, so it's okay if the mother's diet is less than ideal on occasion. Protein and calorie deficiencies result in an energy deficit that reduces the volume of milk produced but doesn't usually compromise the composition of the milk. Breastfeeding women need additional 300 calories per day for the first 6 months and 400 calories per day afterward. Energy spent for milk production is 500 calories per day in the first 6 months and 400 calories per day afterward. So you can see that there is about a 200 calorie per day deficit those first 6 months, which is important to note for postpartum weight loss. ChooseMyPlate.gov is a website that can calculate servings for a breastfeeding mom based on age, weight, height, how often the mother is breastfeeding, and is she in the first 6 months postpartum or after that. To meet the increased caloric intake, breastfeeding mothers should increase their consumption of a variety of fruits, vegetables, and grains, ideally consuming organic foods whenever possible to reduce both the mother and baby's exposures to pesticides, which infants and children are especially sensitive to. Adequate dairy is important. Studies show that when energy intake is reduced while breastfeeding, most women do not make the daily recommended intake of calcium and vitamin D. Fish is recommended for the omega-3 fats that play an important role in brain and eye development. However, some types of fish contain contaminants that can be harmful to both pregnant, nursing women, and children. Fluid needs increase to 3.8 liters per day, which is almost an entire liter more than non-pregnant women. And vegetarian diets while breastfeeding are perfectly acceptable and won't compromise either the mother or infant's nutritional status, but the mother may need to supplement with calcium, vitamin D, vitamin B12, iron, and zinc. The mother may need to adjust her diet if her infant is experiencing any sensitivities to foods that she is consuming, and the foods listed here can be common triggers. There's the potential for nutrient interactions in mothers and their infants, so it's important to know how foods, nutrients, and supplements will affect the infant via the breast milk. Herbal remedies that promote milk flow, also known as galactagogues, have been used in traditional systems of healing to affect the flow of milk. And this list here details herbs that both promote and reduce milk flow. For ethical reasons, scientific information about herb use during lactation is pretty sparse. It's difficult to conduct studies about the effects of specific herbs, so the Academy of Breastfeeding Medicine protocol is to use caution as significant side effects have been documented for some herbs, and it's suggested that a lactation consultant or herbalist who's knowledgeable about herbs should be consulted before using them. There is no recommended routine vitamin or mineral supplement while breastfeeding, and so the mother's diet should be considered, and individual needs should be met. A woman who avoids dairy products completely should supplement with 1,000 milligrams of calcium and 600 IU of vitamin D. There are significant benefits to breastfeeding, and protection from allergies is one of the most important benefits. Breastfed babies are exposed to fewer allergens in the first few months of life because they aren't given formula-based cow's milk or soy products, and less exposure to these foods means less chance of allergy later on. Also, colostrum, the first milk, is especially rich in antibodies and paints a protective coating on the inside of babies' intestines to prevent penetration by potential allergens. Breast milk contains all of the nutrients needed by infants in a highly bioavailable form, and breastfed infants compared with formula-fed infants have a lower incidence of infectious diseases such as diarrhea, ear infection, and lower respiratory tract illness. Many studies prove that breastfeeding enhances the neurodevelopment of infants, and infant feeding practices influence the risk for several chronic diseases of childhood and adolescence. Increased risks for type 1 diabetes, celiac disease, some childhood cancers, and inflammatory bowel disease have been associated with artificial infant feeding and shorter-term breastfeeding. The composition of human milk is incredibly complex, and unlike infant formula, which is standardized, human milk composition is dynamic and varies within a single feeding, over the course of a day, over the course of lactation, and between mothers and populations. There are many different stages of milk, like we touched on earlier in the presentation, but what's important to note is that each stage meets the needs of the growing infant at that stage, over the course of that day, and even during a single feeding. It's also important to note that while human milk substitutes attempt to mimic the composition of breast milk, it isn't possible to match breast milk entirely, as there are numerous components that cannot be replicated. Breast milk selectively nourishes the gut bacteria that infants need and reduces the risk of sudden infant death syndrome. As previously discussed, weight loss is one of the benefits to the mother while breastfeeding. And while it's impossible to effectively measure it, there is a level of bonding and interaction that occurs between a nursing mother and her child. Exercise is encouraged while breastfeeding, and both alcohol and nicotine should be avoided because they are excreted in the breast milk. As far as medications a mother takes, there's always the risk of exposure to the infant via the breast milk. So when assessing the importance of taking either a medication or medicinal herb, 2 questions need to be asked. How much of the drug is excreted in the milk, and at this level of excretion, what are the risks of adverse effects to the infants? Marijuana should be avoided as it can cause structural changes in the brain cells of infants. And a moderate caffeine intake equivalent of 1 cup of coffee per day is acceptable. And there are simple steps to reduce exposure to environmental chemicals that are listed here. And finally, ToxNet LactMed database is a good source for evaluating the effects of medications on breast milk. There are many reasons why a mother may not be able to or may not want to breastfeed their child. And formula is an acceptable alternative. As this chart indicates, there are a wide range of formulas that can be substituted for breast milk in different scenarios, the most common being standard cow milk-based formula. Some babies that may have problems breaking down proteins on their own may do better with partially or extensively hydrolyzed protein formulas that are much easier for the baby to digest. They can also help manage a cow's milk protein allergy, which is fairly common. There are also soy-based formulas that are ideal for those on a vegetarian diet or those that have trouble processing lactose. While there are many factors for the mother to consider in making this personal choice, hopefully this presentation has underscored the history, physiology, and benefits of why breastfeeding is the best option, most importantly for the baby's health.